Thank you very much, Seth, and like to welcome you all. It's really fantastic to see how this society's grown over the last several years. So I don't have a lot of data. It's mostly photographs, but hopefully and text. But hopefully you'll enjoy my brief discussion about our 30-year legacies. I think it's first, though, very important just to remind us of the mission of this organization. It's to promote the prevention of cardiovascular disease, advocate for the actual preservation of cardiovascular health, and disseminate high-quality evidence-based information through the education of healthcare clinicians and their patients, and will continue to be a leading organization in preventive cardiology globally, providing resources and support and serving as a conduit for other related organizations. So if we go back to just the roots of the ASPC, interestingly, the roots are very different from what the organization is today. It actually started with these Preventive Cardiology Academic Awards that and these were recommended by a working group of NIH scientists who felt that it would be important to develop curricula in various medical schools. And the NIH actually awarded 60 institutions, 48% of the medical schools at that time, to get these 5-year awards during 1979 to 1996. And various awardees throughout the country have written textbooks. They've been in various leadership roles with major organizations such as the ACC and the American Heart Association. The American Society for Preventive Cardiology was actually launched under Dr. Joseph Stokes, who was a renowned research investigator, physician, and actually preventive cardiologist. And he worked with the Framingham Heart Study for a number of years. He was also founding dean of UC San Diego Medical School. He was also on the National Cholesterol Education Program, and he promoted research, education, and practice in preventive cardiology. The group was further expanded in a few years later, 1990, by Richard Carlton, who some of us remember. I remember meeting him once, and he was actually best known for his work with the Pawtucket Heart Study in Rhode Island, and he was actually chief of cardiology at Brown, and he had one of these awards. And actually, during this time, prevention efforts really expanded also within the American Heart Association, and there was an AHA Council on Preventive Cardiology that was then merged with the Council on Epidemiology. In fact, Mary Cushman up here is actually one of the past chairs of the Council on Epidemiology and Prevention, which is now in its 55th year. A few personal notes here, just to also commemorate our second president, Dr. Denny Davidson, who regretfully recently passed away. He wrote one of the early textbooks in the field. He had one of these awards, which incidentally helped bring me to UC Irvine. And about 25 years ago, he actually told me about ASPC, but I didn't at that time really appreciate the role that this organization would play in my career until about 20 years later, when Doug Schock and Peter Wilson, they suggested that I get involved. So we have one of the main activities with ASPC over the last 20 years or so has been to help sponsor these debates at the AHA Council on Epidemiology and Prevention on various topics related to preventive cardiology. And in this example here, Rita Rydberg is actually debating against cholesterol screening and treatment at a young age. She actually debated Sam Giddin a few years ago. And I'm not going to read all the topics here that have been the feature of other debates, but you can see we've had a variety of topics over many years. The society actually traditionally was limited mainly to these debates and a small gathering of kind of elite prevention experts until around 1998, when actually Doug Schocken, Peter Wilson, and I felt that it sort of needed transformation to be a more inclusive organization. And we then partnered with actually Compass Management, which has done a fantastic job helping to push this organization to the next level. And the actually new ASPC was really envisioned to include a much more inclusive base of healthcare providers, educators, as well as industry experts in the community that are ultimately involved in actually much of the research, education, and healthcare in the field. Certainly, this meeting that you're at today actually had its roots 4 years ago as a women's preventive cardiology meeting. We recognize that actually Dr. Baum was a leader in this particular area, and actually being in actually Boca Raton represented a fantastic opportunity to partner with this hospital and to create this meeting, which he has now led for 4 years, and it has become the actually flagship meeting of our society. We also have now in its 7th year the Orange County Symposium that started back in 2009. Dr. Greenfield, who is here, as well as Dr. Rosenblatt and myself, are involved in organizing that every year. One important feature of ASPC has been to do outreach to various international groups. We've had joint sessions, for example, at the World Congress of Cardiology in Beijing, also the one in Dubai in 2012, where we helped to co-sponsor a one-day course on preventive cardiology that was offered just before the Congress. Also in Saudi Arabia, and for a number of years at the Great Wall Congress in Beijing. A very important collaboration we have is an affiliation with the International Academy of Cardiology, and every year since 2010, we've had a joint session there, and the current president gives a welcome address at the opening ceremony. We've also, as actually Dr. Sperling pointed out earlier today, have been involved in various other international efforts, such as the Global Forum on Cardiovascular Disease Prevention and the International Council of Cardiovascular Prevention and Rehab, ICCPR. An important other activity of the society that has also gone on for now nearly 20 years is the actually Joseph Stokes Award that we give every year to someone who has had a lifetime achievement in preventive cardiology. And you can see the long list of recipients that have gotten this over the past 20 years. It's important, I commemorate just a couple of the recent awardees. Dr. Bill Cano, who many of you know is probably the most prominent director of the Framingham Heart Study for many, many years, received this award back in 2011. And incidentally, this, and unfortunately, it was actually probably his last lecture, and we commissioned him to write what we believe to be his last paper he wrote before his passing, called 60 Years of Preventive Cardiology, a Framingham Perspective. Several of us also sought to establish the William B. Cano Memorial Lectureship in collaboration with the American Heart Association Council on Epidemiology and Prevention. This is an annual lectureship given to someone to renown in the area, and it is sponsored by both organizations. So we are always looking for actually donations to help support this lectureship. Last year, Dan Levy or I should say last year, 2004, Jerry Stamler was a first lecturer, followed by actually Dan Levy. And in actually Dan Levy's words, he pointed out, reflecting on Bill Cannell, that in 1961, Bill helped to change our understanding of the underlying causes of heart disease and stroke. And with just 2 words, the entire field of preventive cardiology was born. Those 2 words were risk factors, based on his seminal 1961 paper on factors on risk for the development of coronary artery disease. This represented a quantum leap in 20th century medical thinking. No longer would heart disease be viewed as an inevitable condition that struck people in the prime of life without warning, but rather there were risk factors underlying the disease, and identifying them would lead to new treatments to prevent the leading killer of men and women in our country. Also, Dr. Jerry Stamler was given this award just a few years ago. He is probably the most prominent currently living legend in the field of preventive cardiology, and has made enormous contributions and has received many awards also from the American Heart Association for his work going back more than 60 years. He helped found the Department of Preventive Medicine, for example, at Northwestern University, among many other contributions. We have an official journal, which is Clinical Cardiology. We encourage you to consider sending your submissions there, and also an official manual of preventive cardiology, and we endorse the actually Braunwald companion to preventive cardiology that came out a few years ago, and incidentally that was also translated into Chinese, and in fact more copies have been sold in China than in any other part of the world. The last few comments I just want to make here is that there's, of course, a future beyond our history. We hope to expand the expert and certification courses. There has also been discussion about helping to develop a preventive cardiology board certification and perhaps maintenance of certification efforts. Dr. Larry Sperling, our current president, has been very active in that. Also, we seek to increase our partnership with actually other groups involved in cardiovascular disease prevention, like the Preventive Cardiology Nurses Association, cardiac rehab groups, and the Academy of Nutrition and Dietetics on educational programs as well as on meetings. So we're certainly grateful to our legacy of ASPC presidents, including our current president, Dr. Sperling, our sponsors, of course, and of course, Compass Management. And also to thank one more person, Dr. Seth Baum, because he is already busy planning for our 40th anniversary in 2025, and he welcomes you to come back to that. If that's too far in advance for you to plan, at least think about coming to our Orange County Symposium out in sunny Costa Mesa, California, near Newport Beach, on October 17th. So thanks, and hope you enjoyed that overview.